Namaste everybody. So here we are to discuss about the awareness for parents on coronavirus, and we are very happy and delighted to have Dr. Anand Lakshman. He has worked with WHO over 20 years. So welcome, sir.
Thank you very much for having me on this program. Happy to share whatever we can have as information.
Thank you. To start with, the panic of coronavirus from parents, because the children are the dearest ones, precious ones.
Sure.
So in Indian scenario, in the context of India being summer, how much should we really panic about coronavirus?
Right. So I'll use the scout motto here, be prepared. So be prepared is always a good motto, but absolutely clear words, don't panic. There is no reason to believe that we need to panic. Actually, anywhere in the world when it respects to children, and I'll explain that a little later. But in India, if you see what has happened till now, we are in March and we've just started to see a few cases largely related to foreign travel. If at all we see any person-to-person spread of this disease in India, it will also have to look at the environmental characteristics of the temperature going up. So we'll keep a close watch over the next 2 weeks and be prepared.
Dr. Anand, how much is this virus to be worried? Is it killing virus? What is the mortality rate? And as parents, how much should they be shaken about it?
Right. So to put it in perspective, coronavirus is like any other normal, what we call the respiratory viruses, which basically are infection in the throat downwards to the lungs. Fatality rate currently reported is around 2%, but 80-85% of all this fatality happened in senior citizens and people who are senior citizens with living with other disabilities or impairments or lifestyle diseases, etc. Actually, the good news coming from China, I just read the report on the WHO Joint Monitoring Mission in China, says children are the least affected. So for children, it seems to be the one which is least likely to cause even infection. Like any flu or other viral infection, large majority of people will have a silent infection and it will go away in few days.
How much will we even get to know that we are infected?
Well, we are already infected with the information. So everybody is today only talking about coronavirus. Other things like the budget seems to have taken a back foot. But I think from the self-heightened level of awareness, anybody with cough and cold and fever today will definitely report to a medical practitioner. And medical practitioner, using all precautions, if they find that the symptoms are more or less in line, they may send for a test. So I think because of high levels of awareness, we may get to know if we have the symptoms of fever with cold and breathlessness. We may get to know that we may be a suspected case if at all we have these symptoms.
These are the only 3 symptoms we look for. Do you elaborate?
Yes. So what is coronavirus? The name coronavirus sounds very interesting, and just on a aside, it got this name because all viruses have this wall, called the capsid. And coronavirus has this peculiarity of small spike kind of thing, which looks like it's the sun's rays. So it's a Latin for sun is corona. Just a diversion, I'm sorry about that, but just interest for people. It's like any other virus. It's like influenza, it's like rhinovirus, adenovirus, flu viruses, all these viruses. So what it should do is it should cause an infection in the upper respiratory tract. And when we say upper respiratory tract, we mean above the division of the 2 bronchi that go into the lungs. So the pharynx and this part, But in some cases, we are seeing coronavirus enter into the lungs and then infect the lungs. And those kind of cases only are going for further damage. And you are hearing of cases being put, in hospital and things like that. So normally, it's an upper respiratory tract virus. Should be like any cold, go away in 5 to 7 days.
So as a parent, for our children, what we should advise, especially when they're going to school or any gathering? As a precaution, what should they do?
Right. So one thing is children should be definitely reassured by parents. Because in this information age, children are the one who are most susceptible to feel a bit insecure
and misled.
And you see, sometimes if I say, for example, if I explain 2% fatality rate to a parent may still understand, but a child doesn't understand this, right? So for example, my daughter, when I explained to her 2% fatality rate and nothing happens to her, she was reassured, but then she just thought for a second and said, what about my tata, her grandparent? And she was concerned about her after a few seconds. So parents need to reassure their children. Second, about gatherings, any child who has got symptoms like cough, cold, fever should not be sent to school and should be taken care at home. Any child whose parent or really close family member or neighbor who has history of travel to any of the affected countries, which are Iran, China, Italy, you are seeing cases happen elsewhere as well also now, who has developed any symptoms or who is just arrived back, and if they are starting to develop symptoms, should again not go to school. Apart from this,
how long not go to school?
So typically currently recommended quarantine period is 14 days or 2 weeks. Okay. Now obviously exams are here and people are a bit concerned. I think it requires school leaders like you to be a bit more sort of accommodating in the leave policy, etc.
Yeah.
And it should be fine. If they have symptoms, they stay away. If they have a relative who has a symptom with history of travel to these countries, they should stay away. Otherwise, they attend school, and in school, they try as much as possible to be normal. But I think schools will take care beyond that.
Perfect. As a precautionary measure, what all should a child do, or any adult do for that matter? I suddenly see in school that some children are wearing masks.
Right.
Some are feeling awkward about it, wearing. Some are feeling awkward to see someone else wearing. Some are feeling insecure not wearing. So what is the realistic scientific ways of precaution?
Right. So you asked a very good question. Masks are not recommended for any child or any adult. Masks are recommended in 2-3 scenarios. All healthcare workers are to wear masks because they are in the line of fire. All people with symptoms, whether or not diagnosed with corona, because diagnosis is not yet ready and they have symptoms, should wear masks to prevent spread to others. Apart from this, no other person is recommended to wear a mask. So there is no need to panic in wearing masks, because one of the challenges of wearing masks is most adults or children don't know how to wear a mask. They frequently keep touching the mask and they keep adjusting the mask. And yesterday you saw in Parliament, a member of Parliament spoke with the mask, but her mask was down and her nose was out of the mask. So it gives a false sense of security to wear a mask. What's the single most, and then I'll add a second one as an afterthought. Single most important is hand washing. Hand washing in the proper way. 20 seconds, we tell children, sing happy birthday to you twice while you're hand washing. If you wash your hands by singing happy birthday to you twice, that's the right duration of hand wash. But make sure you do a complete wash. So you're washing all surfaces and with soap all the time. All the surfaces are to be completely clean, and then only your hand wash is complete. Frequent hand wash whenever you touch any object or any surface which you think could be infected by somebody else, like in a public place, not in your house, of course. I'm talking of public places. Apart from this, the second most important thing is what we call social distancing. Social distancing simply means if you do not need to, don't go very close to somebody else. Like for example, if we can avoid a handshake, like we did just this is, do a namaste. It's as polite, in fact more polite, and there is nothing wrong. You are greeting the person. So maintain a distance of somebody whom you don't know whether they have symptoms or not, of 3 feet. If you know they don't have symptoms, it's fine. Otherwise, try to maintain some social distance, especially in crowded places.
With washing hand, sanitizer plays a role?
Yes. So, sanitizer for personal use has a role where water and soap is not available.
So, it's not a first option?
It's not the first option. It's not the first option because of several reasons. But the first thing is water and soap are known to do a very fantastic job if you follow the 20-second protocol and all surfaces. Sanitizer has a role where access to water is not there. Sanitizer has a role when you are cleaning, disinfectants have a role when you are cleaning surfaces which could be touched by somebody else, like doorknobs. Say, for example, in your school, you have a doorknob to a computer room. I am giving an example. And a lot of children touch it. Then maybe it makes sense to clean it every hour or so with a disinfectant. Okay. But otherwise, sanitizers have limited role. Like right now, I am carrying a sanitizer with me. If I suddenly cough, then to play precaution, because we don't have water here, I would apply sanitizer because I don't have access to water right here. And I don't want accidentally to touch you and cause a problem. Although I'm not symptomatic, I must declare right now, but for the purposes of demonstration, I have made sure that I have not caused. Now this is for me not to cause to anybody else. Yes. If I went and touched the surface, then somebody will have to disinfect it to prevent a third person from getting it.
So it's the way we can't clean the surface all the time. We wear the footwear to avoid dirt. It's always better to sanitize ourselves than sanitizing everything we go and touch because it's not practical maybe.
It is true, but the commonest surfaces where foam or what we call fomites are, typically it will be keyboards. Like keyboards, doorknobs are the commonest, doorknobs, faucets like taps, public taps. So these are common surfaces which we should take.
Having spoken about faucets, using public toilets, do they lead to any spread?
So as of now, as I said, you see, we have very low risk of current status of infection in India is restricted to people who have had foreign travel. And
but
in general, so the thing is, public toilets are source of various infections. With coronavirus, because the load of people who are infected right now is so low, I don't know whether you think. So if you want to give me an example, I would say public toilets in airports are a concern. But public toilets in a school are not a concern. Because anyway in school, after using public toilet, we are encouraging you to use soap and water. So if you are using soap and water, the right technique, the 20-second technique, then you are fine.
And any soap should do for that matter. Right?
Any soap. There is no restriction. There is no evidence doesn't suggest antibacterial or other soap is better. Soap is required only to lubricate and to cause the surface tension in such a way that all the grease and the germs can be taken out.
In your talk, what I could gather was wearing mask can at times be adverse or can more be prone for it than avoiding it if you are not symptomatic.
Absolutely right. Wearing a mask, especially in categories who are not used to wearing masks, like children or even adults who are not used to.
That is because without a knowledge we will be moving the mask.
And it's very irritating. See, I just tell you, I am used to surgical masks.
Yeah.
But I was wearing it. I was on a flight back from Delhi day before yesterday, and I was wearing it because at the airport I didn't know exactly how many other passengers are there who are coming from international flights. So I was wearing it for only the 3-hour flight because a mask, surgical mask, lasts for about 3 to 4 hours. After that, it's useless because it becomes damp. Then particles can go in. Those 3 to 4 hours, I had to really tell myself all the time. Stay away, don't touch, don't itch your nose, don't do it. For me, who is used to a surgical mask, I had difficulty. Okay, so I can imagine a child with this is going to probably just think about it all the time, touch and have false sense of security. Do not actually make the mask your sort of false sense of, feeling safe or safety. Bring safety through frequent hand wash, avoiding very crowded places of unknown origin and social distancing where possible.
Very right. When I think of not touching my face, I feel like touching my face more often because I'm cautious now. Okay, I should not touch my face, I should not touch my nose.
Correct.
Because that's one of the things advised is try not touching your face.
Correct.
If I take it seriously, then I become more...
I don't know if you saw an interesting viral video. There was this UN spokesperson giving the latest update. And she said touching the face is very risky. And she licked her finger and moved the next page. Because she's so used to changing the page by, just touching. So it's a habit. It's difficult to break.
Having spoken about the gathering, some people said that playing Holi probably is not right. The concept of Holi is only coming from gathering perspective, or there is another school of thought which says that commodities which comes internationally couriered, on the surface maybe there will be virus, and so maybe colors are done in China or China made products. What is it, a myth?
So this is a very interesting topic. If you know the origin of Holi from a scientific kind of explanation perspective, Holi happens in the spring, just before the onset of summer, where you have a lot of these waterborne diseases because water is scarce. Apparently, and I'm just, I'm not speaking as a fact, as just an interest in history kind of person. Apparently, a lot of things which could act as immunizing agents or vaccinating agents were mixed in colors in ancient India to prevent waterborne diseases, and the only way to mass vaccinate was to create a festival.
Okay.
This is the so-called. I'm not vouching for it. Please don't consider that. It's an interesting theory. It's an interesting theory. But coming to specific point here, one, whether we should play Holi, if we are playing with our near and dear ones and we are reasonably safe, I don't see any problem as of now. Of course, water crisis is happening over the last few years. We are thinking about whether to play in a serious way or not. Regarding, colors coming from abroad and all of this, see, the typical time frame for which these viruses remain alive on an inanimate surface is anywhere between 8 to 12 hours maximum. So you cannot expect that a color has landed in somebody's hand just like that, It will take time to reach. So I don't see any problem from that. Other issues, we are facing so many challenges with the chemicals in it and all of that.
Now that we spoke about temperature also, the virus cannot stand certain amount of temperature, and try avoiding ice creams and try having hot water. I bought 3 things. What is your take on it?
Yeah, so you've brought internal temperature, external temperature, and my favorite topic, ice cream, all into the discussion. So these are 3 different things. The virus doesn't like hot weather is true, but it's basically that if the temperature outside becomes very high, the chain of transmission breaks. Basically what happens, if I am infected, I touch my nose and I touch an inanimate object and the weather is hot, then it's going to survive for these 8 to 12 hours, it's going to get reduced to an hour or something, right? So the chain of transmission is going to break. But it's not true with something like ice cream. Why people say don't eat ice cream is, in India we have this that if you eat an ice cream, you'll catch a cold.
Yeah.
If you catch a cold, then you start coughing, then others will start thinking you probably have the COVID virus.
Okay.
So from beyond that, I don't see any foodstuff to be bad or good in any way.
So this ice cream is more got to do with you may catch a common cold and people may misunderstand or something like that?
You may catch a common cold, you may have allergic rhinitis, which is not viral in origin. And then you also are in exam season. I think most parents are very worried about their children taking exams.
So, but directly there is no relevance with coronavirus?
No direct relation. It is about external temperature where inanimate objects will survive. So if you think of the ice cream being contaminated, obviously it's a different thing. Yeah.
And about drinking hot water or water per se, not keeping the throat dry.
So it's good practice. But there is no evidence to say that if you drink hot water, you will be saved, and if you don't. Same things like, for example, some people have been talking about garlic. So these are all general natural practices which may work for many people in terms of general hygiene. But there is no evidence related to COVID-19 or coronavirus 19.
And the pets as such, what do you have to say? Pets.
Oh,
dogs
pets.
and cats in the house.
I have
frowned upon.
Yeah, I have a pet, so I have to speak a little biased here. But the first known transmission to a pet happened yesterday. The first record came in Hong Kong. The first ever known transmission that they have found. In fact, today they are doing the DNA sequencing to see if it's a mutant or a normal variety of COVID-19. Okay. So tomorrow we'll know the details. Okay. But apart from that, if you see China, the outbreak has been so large, really huge. But we haven't heard of that many pets being affected. So pets, the kind of viruses that infect pets are very different in many ways. Like dogs, for example, will not always have the same viral infections that human beings suffer from. Having said that, pets at home, you can't, of course, you can't maintain distance from them in that way. And normally, some people are allergic to pet hair, etc. But beyond that, COVID-19 has got no direct relation to pets.
And how long does it take in our labs to diagnose if I catch cold and if I'm taken to a lab?
Yeah.
How long does it take to get diagnosed, and how many labs in our country as such are equipped?
So as on today, we have 15 labs in the country who are checking for COVID-19.
Only 15.
It's going up to 19 in the next 2-3 days. Here we have the Rajiv Gandhi Institute of Chest Diseases and NIMHANS. They have the National Institute of Virology lab, and Victoria Hospital BMCRI in Bangalore. These are the ones that have the ability to test. But the government is, of course, transportation of specimens and all have become very simple today. So you can get a result back in 48 hours on a suspected case. Having a lab test and results will take about 48 hours today.
One last word, doctor. What do you want to say to the audience?
Well, parents definitely, information overload is there on COVID. Like, 2-3 days back, we heard that one case entered Bangalore. Everybody was completely panicked about it. Don't panic. That's the first thing. Don't panic, because if you see the trends in India as on date, what we are seeing largely foreign travel related, and within that limited reach of those who have foreign traveled, who would have been exposed. Now awareness has increased. So as long as people who have been exposed maintain social distance, frequently hand wash their hands, etc., they are not going to spread. The chain of transmission will be cut. I expect with the weather to change, chain of transmission will be further cut. I am quite hopeful that the next 15 days will bring good news rather than bad news.
Thank you, doctor. Let me say namaste instead of handshake again.
Thank you so much.
Thank you.